My name is Juliana Voloshin. I will be having an interview with you today. We will be talking mostly based on the questions that I collected from our Ukrainian community, and majority of the questions will be related to budget. So thank you so much, the Minister, first of all, that you agreed to have this interview and you agreed to answer all of the questions that has our Ukrainian community. I really appreciate it. And I would like to know your answers for them.
Sure. Well, thank you, first of all, for having me on your program, and really appreciate it, and really appreciate all the wonderful work and the great people from the Ukraine. I know that we've been welcoming many people to Alberta, and there's a strong community of Ukrainian people in Alberta, and our hearts go out to them, and we will continue to be here for you.
Thank you so much for your support and for everything that government have been doing during last 3 years and continue still doing for Ukrainians. First of all, the most popular question was about benefits, and thank you so much that you gave to me a written reply for that question, because our interview had to be first scheduled 1st of April, and it was exactly the time when the benefits stopped working. Many people had some questions, they wanted to know some clarification, and I contacted your press secretary, and she very kindly gave to me the answer, and I shared it with our community. So thank you so much for it.
You're welcome.
Now the next questions. How does budget 2025 specifically aim to reduce wait time for surgeries, and what impact do you expect the new investments to have on access to surgical care?
Right. So surgeries are a large component of what we do in acute care to make sure that people, as they get diagnosed for their surgeries, that they're getting done in a clinically approved time, which is the time that is designated to, so if you need your knee replaced, it's supposed to be done within so many weeks or so many months of time period. And so we've added an additional $72 million to the $305 million budget so that we can do more surgeries. Last year, for 24-25, we did a record number of surgeries, 310,000 surgeries in the province. That was up from previous years of just around the 295,000 number of surgeries. This year, we plan to do 316,000 surgeries. And so what that means is post-COVID, we were seeing that we were getting surgeries done, about 40% of the surgeries were getting done in clinically approved times. Now we're over 60%. I want us to get to 100% of surgeries done in that time frame that is designated that they should be done in. So no one is suffering more than they should be. So that's what we're working towards. We're increasing the number of cancer surgeries by 10%, overall surgeries by 3%. But again, we want to get to 100% of surgeries being done in clinically approved times. That's our goal.
Thank you so much. And I'm really happy to know that much more surgeries are performed this year compared to the previous years. It's really a good.
It's a good news story, but we have that many more people also in the province, and we have more people aging, so we know those numbers are going to continue to climb.
Yeah, and you need to act quickly.
Exactly. And so part of that involves our Alberta Surgical Initiative. So what we're doing is making sure that in all our hospitals, we are expanding the number of surgery rooms that are available, operating rooms. And we're also doing that in our rural communities so that, you don't have to go to, to a big center, Calgary or Edmonton. You can get some of these surgeries that can be done in rural communities. And also we have chartered surgical facilities, and those are all publicly funded surgeries. They're just done in a privately owned surgical center, where that's what they specialize in, elective surgeries. Usually it's eyes or hips or knees, things like that, things that don't necessarily involve a hospital stay or more complex surgery.
Thank you. Next question. Accessing a family doctor continues to be a challenge for many Albertans. What supports of funding in budget 2025 are intended to make it easier for people to find and see a family physician?
Well, we're doing a number of things. So part of the family physician, we're doing a number of things. So part of the family physician piece that everyone probably has heard about is that we've been able to work with the Alberta Medical Association and get a new funding model for family physicians and rural generalists. And what that model is called is the primary care physician compensation model. And really what it is intended to do is have access to more family doctors and rural generalists who will follow you from, from now until later on in life. So it really funds our family doctors to take on more complex patients, to take on more patients. So they get funded a little bit differently than they currently are. We are seeing more doctors coming to the province from out of province and out of country. We also are trying to grow more doctors within our province. So what we've done is we've opened up new centers. We're in the process of opening up new training centers in Lethbridge and in Grand Prairie, so that we have an additional 100 doctors when that's fully operational a year that are going to be trained in rural communities to stay in rural remote communities and work. So we're really looking at adding more doctors in general. I can say that when I first started in June of 2023, we had roughly about 10,600 doctors in the province. And now we have over 12,100 doctors in the province. So we know we're attracting more, we're keeping more of the good ones that we have, and we're also having our medical residents, which are our doctors that are going through their residency. We've been able to negotiate a new contract with them, and we're also giving them incentives like bursary program, where they can get $150,000 or $200,000 to work in a rural or remote location. And that for a 3-year return of service. So that means they work for 3 years in that community, and they'll get that additional funding that helps them pay off some of their student loans, et cetera. So we're looking at lots of different things. We're also looking at team-based care. That's part of the new primary care compensation model too. It's really to help us get people working together. The other piece that I think is important for everybody to know is that we have a new nurse practitioner program as well, kind of first of its kind in Canada, where our nurse practitioners can actually run their own clinics. They can have their own panel of patients, and they can work independently, or they can work in a clinic with other nurse practitioners or family practitioners. So it's really trying to get that team-based care so that everyone has a primary care provider, somebody that they can go to and call their family doctor or their family nurse practitioner. So it's really making sure everyone has access.
Yes, thank you so much. We have 3 more questions left. There is a growing concern about the shortage of doctors across the province. This is more or less, we talked a bit about it right now. What measures budget 2025 are targeted at addressing this shortage and improving the overall availability of physicians, particularly in the rural and remote areas? This is what you just mentioned.
Right. And I was just mentioning about those bursary programs that we have. As I said, for a return of service, the medical residents can actually access these programs. But we also have a rural health action plan where I'm committing additional dollars. It's over $8 million to the health plan to really say, what can we do to incentivize and retain the doctors that we have and nurse practitioners, et cetera, in those rural remote locations. Part of the work that we're also doing on the refocusing is having a very strong primary care agency. So we now have Primary Care Alberta, where their main focus is how do we improve access right across the province? How do we strengthen our primary care networks? How do we strengthen and help clinics to thrive and flourish, particularly in our rural remote locations where it's harder and you have longer distances between locations. We also have the pharmacy-led clinics as well, because even if you don't have a physician in your community, often there is a pharmacy. And so pharmacists in Alberta are able to work to a higher scope than anywhere else in Canada. And so they are able to also do things, renew prescriptions and do some of those other things that kind of take the pressure off the rest of the system.
Thank you so much. The next question is a very popular one. I got so many requests about it, so I would really appreciate if you would be able to give as detailed as possible answer to it. So many internationally trained doctors, especially we are talking right now about Ukrainian doctors and nurses, they're eager to work here, but they face a very long, complex, and expensive licensing process. Does Budget 2025 include any initiatives to better support these professionals and help them to integrate here in Alberta's health system?
So great question. And I would say yes, but it's something that's been a focus of mine from the very beginning, because I know we are not necessarily always producing enough new doctors and healthcare professionals in our province, that we do have to rely on other countries and other provinces. So what I've been working very hard with the College of Physicians and Surgeons, they're the ones that actually license doctors in the province. And so making sure that we have very streamlined processes, that it doesn't take as long, that if there's an ability to make it work, of course, we don't want to compromise on quality. We want to make sure that that the doctors that are coming, particularly if they're doctors, that they have the supports that they need and that they have the proper training that they need to function and be capable within our system. And what we've also done is, prior to March of 2024, if you wanted to register in Alberta, you had to go through the Alberta Health Services. They had to be your sponsor. Whereas now you can have a clinic sponsor you, you can have a municipality sponsor you, you can have another physician sponsor you. You don't have just Alberta Health Services sponsoring you. So that started in March of last year for family physicians. And last November, it opened up for specialists as well. So we have a lot more pathways for doctors to come to Alberta. If there's a physician from another country that's been here, we're also looking at our post-secondaries to see if we cannot improve the bridging programs, so that, is it that they need, maybe they want to be a physician assistant or something else if their qualifications aren't where they need to be. So there's a lot of different things that we're looking at. We're working with our post-secondaries. We're working with the different colleges. Even the College of Nurses, they have really streamlined their processes too. There's lots of supports. I know the College of Pharmacy as well, they're doing their part, the post-secondaries, and we're also working with the federal government, because part of it is also, how can we improve the immigration process so that they can come more seamlessly to take away the barriers that sometimes exist.
It's true, yeah, and it's so important.
It's cheaper, faster, and more efficient to get people here.
Thank you so much. And the last question. It's very popular questions as well. I got it from so many people because so many people use this service. So emergencies room. Emergencies room wait time remains a concern for Albertans. It's quite a long time still in so many clinics, in so many cities. What specifically is your government doing to address this issue? And does the budget 2025 include any new investments that might help to solve this problem?
Well, we're always investing, and this is the highest budget I've ever had. When I first started, my budget was around $26.2 billion. We're closer to $28 billion now when you look at all of the investments in healthcare, which is a big, big budget. But there's so much demand. We have that many more people in Alberta. We also have that many more people that are aging. Right now, 1 in 7 Albertans are 65 years of age and older. Soon that's going to be 1 in 5. Within the next 20 years, that's going to be 1 in 5. We also have, in some ways, a young population, because there's lots of babies being born, which is a very good thing. And so that's another, we have, I believe we had close to 90,000 births in Alberta last year alone. So there's there's a lot of good things that are happening in the province in terms of how do we improve access to acute care. But I also know that because people don't have a family physician, sometimes they go to emergency room when they could have gone somewhere else. So we know that at times it could be as high as 70% of people, 75% of people who go to an emergency room should really go to a family physician or a nurse practitioner, their primary care provider, for that treatment. So if it is not serious, I think there's opportunities for people to call 811 and talk to there's usually a nurse on the other end of the phone call who can help guide them if it's not a serious issue. And maybe they can go to a clinic, help them find a clinic, or even speak to, sometimes there's a doctor available to speak to them directly so that they don't have to go to the emergency room. They can also go online and look at the emergency room online. You can see what emergency rooms, what their wait times are, and perhaps go to a different emergency room that has less pressure on it. Because of course, certain times in certain hospitals is busier than other times. And so they try to keep those numbers. Also, if you need not necessarily to go to the tertiary one, the level 1 hospital, perhaps you broke your arm or something and you need to go to a urgent care center where they can set your arm. That if you look online, it shows you the wait times, and oftentimes the wait times for an urgent care center are less than at the wait room. But again, we're trying to increase the number of doctors. We are making, as well as nurses and nurse practitioners and allied health professionals in our acute care system. We're trying to make sure we have better flow in our hospitals, because what we have is, and this is getting into the weeds a bit, but we have a lot of people who go to hospital, they end up in a room, they have their treatment, and now they're stuck because they need to go, either they need to go home with home care, or they need to go to a continuing care center because now they're not able to manage at home anymore, or maybe they need to go to a mental health facility. And for whatever reason, we don't have spaces available. So we have actually across the province, 1,500 people that are alternative level of care patients. And so sometimes because we have that many, we don't have room on the other end in emergency room. So it backs everything up because we need the people that are in emergency room. Sometimes they need to go into an inpatient bed, and so we need to clear the flow up. So we're looking at helping with our alternative level of care flow. We're looking at adding more professionals, making sure that people have other options like more primary care providers or 811 virtual care. But the other thing we're doing is we're going to actually have to build more facilities. So we've got a plan to build more urgent care centers. We are looking to add spaces in hospitals like the Grey Nuns, the Misericordia. We're looking to add 700 beds between those two towers, one on each facility. We're looking at our other hospitals that we already have. Do they have extra space? How can we add extra space? So we have to look at lots of different options to solve the problem.
Thank you so much. And it's really so amazing. It's so impressive, everything you do. And especially that everything is basically improving, look like. I just wanted to, it's not a question, it's just as a comment, because a couple of people wrote to me about it, that when they see the wait time, it's one amount of time, but when they come, it's totally different one. It's much longer usually. I know it might be not up to you, but just that you would know about it. And if somehow you can influence on it, so they would post more accurate wait time, it would be really appreciated by people.
Well, and I know that myself. And sometimes it's because they're not the only person that's looking at that wait time and saying, oh, the wait time's less over here, so I'm going to go over here. And then a whole bunch of people go over here, and then therefore those wait times go up. And it's not necessarily, real-time data that's happening, because of course it fluctuates as more people come. We're looking at technology to see if we can make improvements in this area. With today's technology, we should be able to find a system that perhaps gives people a better understanding, or at least says, once you get there, this is how long it will actually take. The unfortunate part is you never know if there's an emergency, a car accident, or a severe situation has happened, and those people that are in severe trauma always take precedence over someone who has, is deemed to be less of a trauma issue. So, and people would understand that, obviously if you're going in with a sore thumb versus someone that just had a heart attack, you would want the person with the heart attack to be looked at first. But I know it's very frustrating, especially if you go in with little children and they have to wait a long time. And so we're doing and looking at all the options. How do we triage better? How do we let people know, what their wait times will be? And is there a way that we can make it, more comfortable for everybody as they wait for that emergency surgery or emergency type care? When you go to the ER room, it's always hard. I know I've had to wait many a times I myself have 7 children, as you know, and now 8 grandchildren, and it's always difficult when you have to go and wait.
It's challenging, and it's
challenging.
For people to know that ministers knows about all of this stuff and doing something. I know it's really hard to predict how it might be, and of course, if somebody has much more critical issues, it's so important to serve them first. And people
That's
also
right.
understand it. It just if there is any opportunity to improve it a bit and to show more accurate data, it would be really great.
Well, I can tell you we're looking at the top performing jurisdictions around the world and seeing what we can learn from them, and seeing how we can improve our system, because it is, one, better patient care, but also it helps with the morale and how people feel about going to the hospital. It just provides a better level of care and service for the patient, but also for the staff who work there. And, we have excellent doctors, nurses, healthcare aides, healthcare professionals that really want to do their best. And sometimes just the way the system works, it doesn't allow them to do their best. And so we want everybody to feel good about the work that they're doing and how they're providing that service.
Thank you so much for everything, Cutie, for everything what the government does for us, for all of us. It's really so important. And I'm so thankful that we see things are improving and getting better. And hopefully all these actions will have a nice consequences on people, and we will see great results generally in the community.
Well, and that is my hope and prayer as well, that by the grace of God, we'll get the work done. It's been a big job to refocus the healthcare system. We're seeing, we're getting to where all of the 4 pillars of the healthcare system are going to be firmly in place here very shortly. And I can already see improvements, but there's more improvements to come, and we can never stop. We have to continually strive for improvements. The Arthur Child Cancer Center that we have in Calgary is one of the best in the world, and people don't even know it yet. But, we're so blessed here in Alberta because we have some of the best facilities, but more than that, we have some of the best physicians, the best clinicians, the best specialists, the best nurses, healthcare aides, and researchers. We're doing some phenomenal research. And so I just want people to know that Alberta is really a wonderful place to be in terms of healthcare. We're not perfect. We've got more things that have to be done, but we do have, we're just doing some amazing things here in Alberta. So more to come, but I'll be happy to come back and share some of the great news stories as we do more of the other things that are on our agenda to see improvements in.
Thank you so much, and I really appreciate it. And we'll be waiting for our next interview, because we see each other, as you mentioned before, since 2019, time per time.
We'll have to see each other more often, for sure. Yeah.
Thank you so much again. I really appreciate it that you found time to be able to share your thoughts and answer for the questions which was gathered from the Ukrainian community. And I'm sure we will repeat this interview again with more updates, with more news. And I'm really looking to it.
I look forward to it as well. Thank you so much. And thank you to all your listeners and viewers, etc. So thank you.
Thank you. Have a great day.
You too. Take care.
Bye.
Bye-bye.